We got a few different stories here today. What's going on, everybody? Headed to the weekend. Hopefully you all are doing well. Thanksgiving's a day closer, everybody. As I said yesterday in my tray pack of videos, go out there and celebrate it big time. Celebrate it like Newsom did. Get as many friends together in as tight and enclosed space as possible. Don't wear any masks. If they can do it, we can do it. Male Wipeout contestant dies after completing the course and complaining about chest pains before going into cardiac arrest. I want to see a photo of this guy. Sometimes, I haven't watched Wipeout in a long time. It was not really an interesting show. The Japanese version they stole it from was a lot better. But some of these contestants, they didn't really have the look like you'll see on the newer type shows. The American Ninja Warrior types. They never really look exactly like those people, like actual athletes. And that's the point, right? To get some comedic relief at the expense of people that probably aren't as athletic as the obstacles that they're trying to complete would call for. The male contestant needed medical attention after completing the course and was tended to by emergency personnel who were already on site. He was taken to a local hospital, but later died. Every Wipeout contestant is expected to undergo medical exams before they can participate on the show. 2 paramedics are also on site, along with a safety producer and a paramedic coordinator. Wipeout, originally airing from 2008 to 2014 on ABC, is getting an upcoming reboot through TBS. There you see the course. I remember they had these on there before. I'm really just looking to see if they have anything, again, photo-wise. Law enforcement sources said that they have received a cardiac arrest call just before noon. They added that the medics on the scene were already using a defibrillator on the contestant. According to sources, the contestant had complained about chest pains as soon as he finished the course. Every Wipeout contestant is expected to undergo medical exams. That's before, obviously, so during the competition, different story. Edible Shine North America, the production company behind the show, released a statement offering their condolences to the unnamed contestant. Okay, so there we have it. This is really just a bare bones story. We're not going to get any photos, so we'll see what comes out of it. We offer our heartfelt condolences to the family, and our thoughts are with them at this time, they said. Wipeout, originally airing, we already read that. TBS released a statement that said, "We are devastated to have learned of his passing, and our deepest sympathy goes out to the family." Comments, it's kind of dicey. I don't know if I want to check it out. Let's hope that people are sympathetic, though. Fingers crossed. They really do get wiped out right off the bat. Miss Carolina ruined my hope for humanity. And it's a woman, darn it! Or should I not assume? Somebody says lawsuit. Another person said here, the original Japanese version of the show is brilliant. I agree, which is what I said at the top of this. I love the show. I was wondering if it was ever coming back. Wipeout. Signed his own death certificate. R.I.P. Let's see, what else do we have? Tough luck, stupid. Let's thin out the herd at every opportunity. Miss Luscious. Dallas Fort Worth. Here we go. We're not talking about world-class athletes. Most of these people are couch potatoes striving for attention. And that's what I said. That's the way the show is casted, right? It's people that aren't even as in good a shape as me, and I'm just an average guy, so people a little bit less. And then you throw them on this obstacle course, they go head first into stuff, and that's generally why it's funny. So, yeah, definitely an unfortunate set of circumstances. I'd go on the show, but that's because there's no way I can hang on American Ninja Warrior. So, tough loss here. Definitely not something you'd expect to happen. Let's see what else is going on in the news. It's breaking news this evening. By the time you see this, they may have the suspect in custody, but for now, the individual remains at large. Don't have any footage or anything like that to show. It says here, Wisconsin police launch manhunt for gunman who shot and wounded 7 adults and a teenager at a mall. The shooter opened fire at the Mayfair Mall in Wauwatosa on Friday around 3 p.m. The mall is around 7 miles outside of Milwaukee. Wauwatosa police said 8 people were injured and taken away in ambulances. Wauwatosa police said they think the shooting was a result of an argument. Dennis McBride Mayor of Wauwatosa, said the injuries were not life-threatening. The suspect, a white male in his 20s or 30s, remains at large. No word yet on whether Democrats are going to try to use this for political purposes, to drive the gun control agenda. They may already be doing so on Twitter. Oh wait, the election's already over, supposedly, so they're not going to push back on this at all. Here you see some photos from the scene, the aftermath, of course. Look at that racist cop telling that black family to go away. Look at, they're not even allowed to go near the scene just because they're black. Yeah, we have some fun, come on. It's Friday night, Saturday morning when you'll see this. They said shortly before 9:30 p.m. local time that the Mayfair Mall had been cleared and was secure. Dennis McBride, as we heard, the mayor of Wauwatosa, said none of those injured appeared to have life-threatening injuries, which is great news. We don't want to see any of those innocent mall-goers getting shot, killed, so hopefully everybody pulls through. Police said that they were called at 2:50 p.m. When the emergency services arrived, the gunman was no longer on the scene, said Barry Weber, chief of Wauwatosa Police. There have not been any fatalities that I am aware of, he said. Now that was at that time. By the time you see this, things may have changed. They said a lot of the action took place near the Macy's, so that's why you're seeing a lot of Macy's photos here. And yes, they're still in business if you didn't know that. He said all were alive when the emergency services took them to the hospital. 75 police officers and at least 10 ambulances were requested to the scene around 3 p.m. The mall and a nearby school were placed on lockdown. It'll be curious to see how far this guy gets. Let's take a look. Oh, they've got a map here. Just outside of Milwaukee, they said. So, yeah, I'm not familiar with Wauwatosa. Maybe it's a smaller city, more rural. So maybe it was easier for him to get lost somewhere in there. But we'll see. WISN 12 News reported that the majority of victims were shot near the Macy's. A woman who was inside Macy's told CBS 58 she heard what sounded like 8 to 12 gunshots right outside the store. We were on the 3rd floor, said Jill Woolley. We heard 8 to 12 gunshots and dropped to the floor. She said she did not see the gunman, but managed to find a stairwell and head down into Macy's basement. We went through another doorway and found more employees and told them what was happening. They immediately ran off to find some information and what we should do. Shortly after, we all ran out of the building. Now, when she says they all ran off to find some more information, yeah, I'm guessing they all ran off to just run off. She was with her 79-year-old mother, and both were shaken but unharmed. Mr. McBride told ABC News the perpetrator is at large and that SWAT teams are currently circling the mall looking for him. They got SWAT involved. Sounds like it'll be a suicide by police, most likely, if the guy tries to get live with SWAT. Police secured the building and allowed those inside the mall to filter out. Wauwatosa Police Department asked people to avoid the area. IDK, what the F is happening? But I'm sitting in P.F. Chang's and people are running out of Mayfair Mall. No one is telling us what is going on, one person tweeted. Well, thank goodness that they tweeted. Thank goodness that they were so concerned for their life, like they said here. So concerned about information that they managed to tweet it out, because I'm sure that Twitter was going to go ahead and tell them what was going on. That said, just being sarcastic with it a little bit. What do you mean? What are they supposed to tell you? Is your server supposed to come up and tell you what's going on? The Wauwatosa Police Department, are they going to just magically jump on Twitter? Hey, Officer Jones, why don't you go tell those people on Twitter that are sitting at the P.F. Chang's, go tweet at them, tell them what's going on. I am fine. I am away from the area. Please stay away from the area to allow emergency personnel to get through. Brookfield Properties, which manages Mayfair Mall, said in a statement, "We are disheartened and angered that our guests and tenants were subject to this violent incident today. We are thankful for our partners at the Wauwatosa Police Department, and we are cooperating with them as their investigation develops." Now, as I said, things may change by the time you see this, but right now, just 8 shot, and nobody appears to have critical injuries, which is good. Let's hope that doesn't change. Now, comments. Let's see what they say. Keep in mind, this is the Daily Mail, so it's a European publication. But look at this person. Must be Antigua. I've never heard of them. I wonder what kind of gang they are. Haha, bet not. The usual delusional type. What a coincidence. This occurred as Kyle Rittenhouse was released from a Wisconsin jail. Interesting. Another typical Republican Trumpy. Guaranteed. Some dickbag here says, no doubt. Like all those MAGA losers that smashed up Portland for 6 months straight. Someone should go to Portland and shut those MAGA folks down. Now. How could somebody say that? A dose of sarcasm? Somebody with the same name as mine? Registered for an account there? I wonder. $100 says the shooter owns a MAGA hat? Yep, like all those MAGA folks that rioted across the US all summer long. Damn them. That one has 3 downvotes. I love it. Who's that from? A dose of sarcasm again? Oh, he's not even funny. He's getting all these downvotes. They really are just clueless. I love it so much. It must be so great to live in that world of blissful ignorance and not really have an idea of what's going on in society. I love those people. All right, last story for the day. Had enough drama, enough death, enough shooting. Here we go. So we got some good news. Let's close it out with this. Pfizer files for emergency authorization from the FDA for its COVID-19 vaccine, so it can be approved for the December rollout. Pfizer's application to the FDA comes just days after the drug maker reported final trial results that showed that the vaccine was 95% effective. Pfizer expects the FDA to grant emergency use by mid-December and said they will begin shipping doses almost immediately. Vice President Mike Pence said late Thursday that the vaccine will be rolled out across the country within 24 hours of the FDA granting emergency use. Officials have said they hope to have about 20 million of Pfizer's vaccine doses, which is enough to vaccinate 10 million Americans by the end of the year. Rival company Moderna is expected to be the next company to seek an emergency use nod for its COVID-19 vaccine. The U.S. also expects to have 20 million doses of Moderna's vaccine available to distribute next month. Despite the promising news, Dr. Anthony Fauci urged Americans not to let their guard down as infections continue to rise across the country. Fauci, he's been putting a damper on things for the longest time. Fauci sought to dispel concerns about the vaccines, saying both were solid. Fauci's so negative, now he's trying to be positive. You know, this is something that I've been thinking about and something I talked about months ago in the lead up to this, and just kind of like a prediction. But watch, you'll see. And I bet a lot of you, people who watch my kind of videos, I think you all know this stuff. You're a lot more educated than society at large. First off, we know that individuals who they say are going to get this are kind of the first responder types. Individuals in hospitals, that's what I've heard. So I was joking with my wife about it. I talked about that in a video about a week ago. I don't know who else they're including in that. Are they counting first responders, police, firefighters, teachers, anybody else on the frontline workers, your grocery store workers, your delivery drivers? Are those people out there also getting it first? I know it's going to doctors and nurses, healthcare staff first, like it should, because they've been out there putting it on the line, just like all essential workers have. So to me, I'm good with them getting in line first. So what I'm getting at is what's going to happen. I just know this is going to happen. I know it's going to happen because they've been talking about this already. They talked about it when they said that not enough POCs were included in the trials. And Moderna even pushed their trial back to get more POCs as part of that trial. Like it mattered. Like, does it matter? Get it done. Get it tested on people. Let's get this bad boy going. You're telling me that during a trial, you're still thinking about diversity? Oh, well, if black people make up 13% of the population, then they've got to make up 13% of our people in the study. And let's make sure we have an accurate number of black females and Native American women, and make sure we get enough gays and trans folk in there too. Now, having some fun with it, shit's going to get hyped when they release this for everyone, because you know that there's going to be claims out there. You can see it now. You don't need the binoculars. You can see it coming. They're going to tell you that these oppressed groups aren't getting it in the numbers that they need to. Like, there's some sinister attempt by companies to go ahead and give the vaccine to individuals based on preference. Here's where I'm going with this. I bet that there's going to be groups out there that are advocating for certain races, genders, preferences to get preference for the drug because they are going to use the line, we're most affected by this. We're most affected. We saw our deaths occur at rates greater than X, Y, or Z. So therefore, we must be at the front of the line. The fight's going to happen, baby. I know it's going to happen. I'm just going to sit back, White male, nobody wants to hear what I say. I'm in good enough shape anyway. So if there's some fat person that feels like they want to push their way to the front of the line to get in front of me, I'm just going to be kicking back, doing some jumping jacks, doing some push-ups, running some laps, just trying to make sure that I do my thing to put myself in the best position to be in good shape to where I'm minimizing my risk factors. And obviously that includes masks, distancing, all of that stuff. But it's going to happen, everybody. So that's my not so bold prediction. Let's read a little bit more about this. It took just 248 days to get from the day we announced our plans to collaborate with BioNTech to our FDA submission day. We have operated at extraordinary speed in our clinical development program, from concept to regulatory finding, while always maintaining our focus on safety. And this is Pfizer saying this. The company expects the FDA to grant emergency use by mid-December and said they will begin shipping doses almost immediately. Vice President Pence, we heard about that. Officials have said they hope to have about 20 million of Pfizer's vaccine doses, which is enough to vaccinate 10 million Americans by the end of the year. So keep those numbers in mind, especially if you work in healthcare or have loved ones who work in healthcare, that we're looking at the end of the year for the first round of this stuff coming out. Rival company Moderna is expected to be the next company to seek an emergency use nod, which we also heard about. Despite the promising news, Dr. Fauci, yeah. If the cavalry is on the way, you don't stop shooting, Fauci said. Maybe not the best news given that Wisconsin story, huh? An FDA advisory committee will now determine if Pfizer's vaccine is safe enough to be given emergency authorization so it can start to be distributed. It is not yet clear how long the FDA will take to review Pfizer's vaccine findings. Pause it here if you want to read a little bit more of the story. And here's something, we'll just end it here, then I'll take a quick look at the comments. But how the breakthrough vaccine works. Scientists take the part of the virus's genetic code, which builds the distinctive spike protein on its surface. These genetic instructions are placed in a fat droplet, which is injected into the patient. Okay, I'm with you. Patients' immune cells make the spike protein so their body can recognize it. This protein allows the virus to latch on to protein receptors on human cells so it can get inside and spread throughout the body. Called into action by the spike protein, the immune system produces antibodies which stop the virus getting into the cells, and T cells, which destroy infected cells. I'm on number 5 now. If that person ever meets the coronavirus, these antibodies and T cells will fight it off in exactly the same way. I'm actually going to donate blood next week, right after Thanksgiving. I think they do a antibody test there. Again, pause it if you want to read more of this story. They did do antibody tests some time ago. I'm not sure if they still do that. There's a chart for you to take a look at. But I'm going to donate some blood. That's my post-holiday work. It'll probably have too much cholesterol in it. But if they do end up having some kind of test for antibodies and I hear something about it, I'll tell you all about it. I guess I have one of the rarer, not like the rarest, but kind of rare blood types for white people. I don't know if that's a good or a bad thing. It's good in the sense that it's rare, but I guess not as many people would need the donation. So, you mean the Trump vaccine? Now if you get the shot, a bit of Trump is in you. Trump DNA. Don't want it, somebody in Houston says. No hashtag Pfizer vaccine for me. Somebody else here says Big Pharma hates Trump because he tried to lower drug prices. We need to regulate the drug prices, stop protecting drugs from generic competition, and regulate executive compensation. All right, everybody. So that's all I got. Again, like I've always asked, when it comes out, are you getting it? If your job tells you you have to get it as a condition of your employment, what are you going to do? All right, take it easy, everybody. Have a good weekend. Thanks for watching, and be well.